what we call typical antipsychotics. Example of that would be atypical. It is also divided into three main categories, which include the phenothiazines and burophenons and the taxanes. Under the phenothiazines, we have what the commonly used chlorpromazine, promethazine, and florfenazine. Those are the three under phenothiazines, typical antipsychotics. Under butorphenons, typical antipsychotics would have haloperidol, droperidol, and fenfluridol. Under still under typical, we call extrapyramidal side effects. If you did that in medical school, you know that there are basically three extrapyramidal side effects, and these there are four. These four are now divided, and then you have to know of the four what are the characteristics of those four. Still, you find the first characteristics of extrapyramidal effect is akathisia. Akathisia is one of the examples of extrapyramidal effects. We we said there are four, so to list them first, we shall have akathisia, dystonia, Parkinsonism, and tardive dyskinesia. Now, we need to describe each and every one of the four, which will give us, we shall start with akathisia, which is the feeling of restlessness, like you can't be still, you feel restless, and you feel you have to be always moving, and okay, you're agitated. So that is we call akathisia. The next I'll talk about is dystonia. So dystonia is when you feel involuntary muscle contractions. Okay, involuntary muscle contraction. You feel you have hand jerking and maybe neck. Some things that you don't have control of and it's happening involuntary, just like the word says, involuntary muscle contractions. That is the second, what we call dystonia. The third is Parkinsonism. Parkinsonism is a bit obvious. We all know it is also a muscle problem led by involuntary muscle, but this is general. Hmm? Parkinson's, we have when you're shaking, the muscles are shaking. That is Parkinson, like involuntary. It is due to imbalance of the serotonin and dopamine in the brain, right? Uh, yes, that is still an extra pyramidal effect. And we're saying these are side effects because this comes after treatment with the drug. After you've taken the drug, you get these side effects. The drug that is supposed to relieve a certain symptom, like in this case, bipolar. But when you're treating bipolar affective disorder, then you're getting Parkinson. You get in the process of treatment of bad, you're getting a side effect of Parkinson. So you need to balance because both you're dealing with the neurotransmitters of serotonin and dopamine. You need to balance the level of serotonin. Excess serotonin or excess dopamine will lead to Parkinson. Yet the reverse is leading to uh, insufficient secretion of dopamine and insufficient secretion of serotonin leads to bad bipolar affective disorder. So we need to balance our treatment in those two. So the next extrapyramidal side effect I would like to discuss will be tardive dyskinesia. Tardive dyskinesia, in this side effect, we are looking at a situation where you have involuntary contractions of the facial muscles. So, like the tongue, you find this case, this patient, the tongue is always out. Secondly, you have a twitching of the cheeks. You've seen in mental hospitals patients which have their faces one on the other side. The muscle of the left is pulling all the muscles of the right. So that kind of situation is what we call um, tardive dyskinesia. It's also a side effect of treatment with atypical antipsychotic. All right, members, that is where I submit to end. Those are the 4 side effects of atypical antipsychotics. We shall see others later in the next. Thank you.